My name is Cyrus. I'm owner and formulator for Pure Lab Vitamins here in Ottawa. I've been a compounding pharmacist for half my life, and in that profession, that automatically exposes you to alternative approaches to health. I was born and raised in West Germany to a pharmacist mother, a critically thinking pharmacist mother, and a physician dad. I also have a physician brother. So you can imagine I was practically spoon-fed with medicine 3 times a day. I studied pharmacy with major in biochemistry in beautiful Düsseldorf, Germany, before moving to Canada in 2000. And just remembering when I kind of got let loose after university into the public pharmacies, I thought drugs were the answer to all ailments. And don't get me wrong, like mainstream medicine has its place, but I think especially during acute conditions, and obviously surgery and during injuries, it's quite amazing what medicine can do today in remote controlling our system and keeping us alive and fixing our acute problems. But over the years, especially while working with the few open-minded medical doctors and many naturopathic doctors, it became pretty quickly obvious to me that root cause of chronic lifestyle-induced conditions can only truly be addressed with changing diet and lifestyle. Because if the causing agent is there, then you've got to change those things. No? But I also think that a targeted supplemental regime during those changes of diet and lifestyle will quickly address the underlying deficiencies, especially mineral B vitamin deficiencies. And with that, then, together with your work in changing diet and lifestyle, will achieve a quicker and more efficient therapeutic turnaround. So today, I want to talk about statistics on diabetes in Canada. I want to define or explain what is the difference between pre-diabetes and regular diabetes. And I always, in this case, talk about type 2 diabetes. There is a section where I'll explain the difference between type 1, 2, and 3. I will explain the diet and lifestyle factors that contribute to diabetes, complications of this condition, and also talk very briefly about the common prescription drugs used for type 2 diabetes or type 1, and also metabolic syndrome. And then, and that's the main focus here, I would like to kind of elaborate on lifestyle and nutritional support for people with diabetes, talk about the specific depletions, and then targeted dosages of these supplements. So let's get going. First of all, statistics, they are alarming. Canada ranks number 3 in the world behind the US and Portugal in the prevalence of diabetes in the average adult population. Within Canada, Newfoundland, Labrador, and Nova Scotia, Ontario have the highest prevalence of diagnosed diabetes, while Nunavut, Alberta, and Quebec rank lowest, which doesn't mean Nunavut, Alberta, and Quebec have low incidence of diabetes. They are also very high. But within Canada, those are the regions with highest occurrence. In total, in the year 2013-14, there was approximately 3 million people in Canada, which is 8.1% dealing with diagnosed type 2 or type 1 diabetes. But then that's kind of also alarming is that only 50% of Canadians can actually identify common early warning signs of type 2 diabetes, which oftentimes gets overlooked for way too long. And those warning signs are excessive thirst and urination. If you go into phases where water just cannot quench your thirst, and then subsequently you're starting to pee, which is the attempt of the body to dilute your blood to make the sugar concentration or get the sugar concentration down. And in this process, you're obviously diluting your whole system, and you're also losing very valuable minerals that we will talk about a little bit later. You will also see impaired wound healing. Small cuts and scrapes linger much longer and heal less well. Recurring urinary tract infections or other recurring infections in the body. Tingling in hands and feet in the peripheral tissues, far away from the pump, the heart. That is where diabetic side effects occur first, because the circulation is decreased further away from the pump. There's also the symptom of unexplained weight gain or loss, very drastic ups and downs, crushing fatigue. Undiagnosed diabetes has an impact on the blood circulation within the eyeball, within the retina, and with that, blurred vision can occur and go away and reoccur. And then there's also erectile dysfunction in men, but also decreased libido in men and women. And that's all according to Diabetes Canada. So what is pre-diabetes? It's actually a precondition, as the name implies, where the blood sugar levels are higher than normal, but not yet high enough to be fully diagnosed with type 2 diabetes. Being diagnosed with pre-diabetes is technically, from my point of view, a good thing, because it gives you the chance and the choice to change it and come back from it. And there's lots of tools we can do today with the right diet, lifestyle changes, and potentially supplements to reverse this diagnosis of pre-diabetes. If this gets left unmanaged, then more than 50% of individuals will run into full-blown type 2 diabetes within 10 years. So this needs to be taken serious. It's nothing that should be taken lightly. So what are the different types? There's type 1 diabetes, also known as juvenile diabetes. It's an autoimmune disease where our own immune system attacks the pancreatic islet cells that are the cells that make our insulin. And this is usually happens in an autoimmune storm. Usually onset is in early teenage age. And over the course of just a few weeks, this attack takes place, eradicating islet cells, and the individuals quickly fall into diabetic comas, get then diagnosed with type 1 diabetes, and from that moment on require insulin to regulate their blood sugar. All type 1 diabetics are insulin dependent. Then there's type 2, which is the most common type of diabetes, and that's caused by a combination of genetic, behavioral, which includes lifestyle and diet, and also sometimes environmental factors. People with type 2 diabetes can no longer properly manage blood sugar. Either they cannot make enough insulin from the pancreatic islet cells in response to blood sugar levels, or the sensitivity of the insulin receptor is somewhat reduced due to fluctuating high blood sugar levels and also obesity. Insulin is practically a hormone. It's a very big molecule, a polypeptide, and its function is to tell the cells to take sugar in from the blood to make sure blood sugar levels do not get too high, which would turn nice thin blood into thick and sticky ketchup-like blood. And we all know how much sugar is in ketchup. So it's kind of an interesting comparison here. So type 3 diabetes then is also known as gestational diabetes. It's usually temporary form of diabetes and occurs during pregnancy. Occurrence in the population is about 20% of pregnant women develop this type of diabetes, and for many it goes away, luckily, but it right away also increases your risk of developing diabetes, cardiovascular disease, and or metabolic syndrome later in life, and this risk is increased for both the mother and the child. So when it comes to the contributing factors others than, we talk about, first of all, overweight or obesity. It's the most important risk factor. This excess body weight, which is not just your belly and hip weight, it's also the so-called visceral fat sitting around the organs within the core structure of our body. That fat is very influential in our in increasing the body's demand to produce insulin. And the pancreatic islet cells can initially fill this demand and produce more whenever there is more management necessary, but these cells are not capable to do this unlimited. And at some point then, the insulin production, even if there is a requirement, a need, slowly goes down. And that's when we develop high blood sugar levels, because the sugar can no longer be taken into the cells, because the hormone that tells the cells to do so is no longer being produced sufficiently. Physical activity is another contributing factor. Sedentary lifestyles are directly connected to lesser ability to excrete insulin and also to manage blood sugar levels. And on the other hand, exercise has shown to improve glycemic control, which is blood sugar management. It also clearly decreases insulin resistance, lowers our blood pressure, improves our fats in the blood, which also increases the stickiness and thickness of our blood, and with that reduces circulation in the fine capillary systems like the periphery, as well as all the organs or the retina. Physical inactivity or exercise improves all these things independent of body weight. One other little known or lesser known tidbit here is that if you can shift your body composition from less fat to more muscle, you're actually benefiting from a very simple mechanism, because fatty tissue does not burn any energy, zero, whereas if you build more muscle, your actual basic level of caloric utilization or the amount of calories that you burn goes up. Muscles or muscle tissue actually burns calories even at resting compared to fat, fatty tissue anyway. Smoking, vaping definitely increases glycemic levels, also impairs insulin sensitivity. To explain this term quickly, insulin is a hormone that has to dock onto a cell, and it does that at a specific receptor site. And these receptors on the cellular level are very important to transmit the information that insulin levels are high currently to control blood sugar levels. If the receptor isn't working properly, you might have lots of insulin in circulation, but the information is not entering into the cell because the receptor is sleepy, not responsive enough. And smoking has a direct impact on this receptor sensitivity. Smoking also increases or promotes obesity, and has generally been associated with an increased risk of type 2 diabetes. Another contributing factor is the so-called metabolic syndrome. This here is the definition from the Mayo Clinic, and that's defined as a cluster of conditions that occur together, increasing your risk of heart disease, stroke, and also full-blown type 2 diabetes. And those conditions include high blood pressure, high blood sugar or higher blood sugar levels, excess body fat, especially around the waist, which includes the visceral fat inside the waistline around the organs, and also high cholesterol, especially bad cholesterol, LDL, and high triglyceride, which means fat levels in your blood. And here, just to give you some numbers to kind of compare to, metabolic syndrome marker is the waistline in women over 35 inches, in men over 40. You don't have to memorize these. You'll also be able to get, I think as participants, you get an email with a link to the recording of this webinar anyways, where you could review these slides at a later date. So you don't have to scramble to write these down. Yeah, high triglyceride levels over 1.7. If your fasting blood sugar is over 5.6, that's definitely a marker. If your blood pressure is over 130/85, and if your good cholesterol, so-called HDL, or high density lipoprotein, is below a certain level, then that also are contributing factors towards metabolic syndrome. Other contributing factors, and one that I personally relate to, is sleep apnea, which is the case when your breathing rhythm is interrupted while you sleep, which practically puts you into a constant chronic stress state while you sleep. You never reach deep, relaxing, refreshing, and replenishing sleep. You're always superficial, and this chronic exposure to stress, practically suffocating with every second or third breath, is highly inflammatory and has huge impact on your general health. Improving your sleep with a so-called CPAP machine, which are very modern these days and very easy to handle and very non-intrusive into your nighttime routines, has huge impact on anybody dealing with metabolic syndrome. There's also another factor. If you have a history of having given birth to a baby over 9 pounds, that puts a woman at a greater risk of developing type 2 diabetes later in life. Also is a somewhat elevated risk factor for the baby or the person that comes that this baby becomes later on in life. Ethnicity has a huge impact on type 2 diabetes. Certain ethnic groups have a much higher incidence of type 2 diabetes, especially African, Arabian, Asian, Indian, Hispanic, and also indigenous people have a much higher occurrence of type 2 diabetes in their population. And then there's also one lesser known point, and that is systemic hyperacidity. Too much acidity in our body, not just the stomach, in our whole body. It means in the blood, the lymph system, the connective tissue between the cells, and in later stages within the cells as well, is a pro-inflammatory factor. An acidic pH measured in saliva or urine predisposes the body to inflammation and, over time, into degenerative disease. There's clear connection between cardiovascular disease, atherosclerosis, which is the plugging up of the blood vessels, and then heart attacks or strokes. Also, there's a clear connection between high acidic pH and cholesterol levels, and also blood pressure. Direct connection to diabetes and obesity. And also, you can imagine if a body is constantly acidic, the body uses its own alkaline reservoirs, alkaline minerals from bone and muscle reservoirs to help balance pH in the blood, because the blood pH needs to be maintained within a very narrow window and has very high priority. Because if the blood would get too acidic, we would very quickly die of acidosis. So then this means that our muscles give up their own precious resources like magnesium, zinc, selenium, chromium, and all the trace minerals, and also calcium. And the calcium from the bones gets flushed back into the system to help balance the blood pH, and that leads over long term into osteoporosis. And the acidity itself also fuels arthritis. Obviously, if your body is trying to manage systemic hyperacidity over time, it will directly lead into mineral deficiencies that then causes other potential problems like spasms, chronic pain, migraines, constipation, and then in later stages, much more pronounced chronic disease. Here's a few studies just to throw them at you. There's clear connection between lifestyle-induced low-grade inflammation and conditions causing diabetes, blood pressure, metabolic syndrome, and also obesity. Managing your pH is, from my point of view, a thing that should become mainstream, or should receive mainstream attention to really prevent the development of chronic inflammatory conditions. And here we have at Pure Life Vitamins our second product in all the at all times, was launched right after the magnesium. That's AlkaPure pH. It's a potent and powerful alkalining formulation. It's calcium and sodium, calcium-free and sodium-potassium balanced, which is very important. I actually have a good 1 hour presentation on just this product alone. It helps you once you find out that your pH is acidic, which you can do with test strips that we distribute as well. You take 3 capsules twice daily on empty stomach. until you see your blood or salivary pH levels rise back to 7, and then you find your maintenance dose that keeps you there, and to make up for your lifestyle and your stress levels and to kind of balance your acidic requirements. It is important to use this on an empty stomach because the only good acid in our system is gastric acid. We need this acid to be there to receive a meal, to process and break down carbs, fats, and proteins, to also dissolve minerals and absorb minerals. We need stomach acid to be present. So you don't want to use an alkalining supplement right before, during, or right after a meal, and with that neutralize stomach acid when you actually need it there to receive the meal. So the best times are between the meals, or at least 1 hour, or the earliest would be 1 hour after a meal. You take 3 capsules twice daily, and while monitoring your pH in saliva or urine, and hopefully slowly see your pH, your average pH, rise up to around 7, and then you can dose down the AlkaPure and maintain proper levels there. In doing so, you will see that all kinds of inflammatory conditions subside very slowly, but profoundly. I've had gout patients clear up very quickly in an acute attack, but then by maintaining AlkaPure long term, they actually were able to fully prevent gout attacks altogether. Also, anybody dealing with any kind of itis, whether it's carpal tunnel syndrome, plantar fasciitis, bursitis, long-term Achilles tendonitis, and so forth, this tends to slowly subside over the course of 4 to 6 weeks. And obviously, in this whole bigger picture of systemic hyperacidity, diet, the avoidance of acidifying foods, which is all the tasty ones and all the fun ones, and the increase of alkalining foods is important, and exercise plays a huge role here as well. So then we come to complications of diabetes, and that's a bit of a dark slide here. Diabetics account for about 30% of strokes and 40% of heart attacks globally. Kidney failure requiring dialysis, 50% of those cases are diabetics. 70% of non-traumatic amputations come from diabetics, simply because the blood circulation in the peripheral limbs slows down, and with that, the tissues simply start to fall apart. It's not very nice. It requires blood sugar maintenance early on to prevent this. There's also diabetic neuropathies, which is when the nerve endings, mostly in hands and feet, start to tingle and provide shooting pain because the oxygen and nutrient supply into those nerve endings is compromised due to the viscosity of the blood. Secondly, also, those tissues have metabolic waste that needs to be removed. And if circulation is not present or not happening, then those tissues become more and more loaded with waste, to become toxic, and that then also leads to the nerve endings getting all wonky and firing when they shouldn't. Chronic pain is for that reason, a complication of diabetes. Retinopathy, when the retina in the eye is suffering due to lack of circulation, oxygen, and nutrient supply. Skin ulcers, which usually occur on the legs, most often, but can be anywhere else. And if they can't heal properly and infect, these ulcers turn infectious, then we have a real problem at hand. Prescription options. There's first and foremost oral medications. The one most commonly used is metformin or glucophage. It actually makes the liver produce less glucose from glucagon, which is the storage form of sugar. So you're no longer getting as much blood sugar from your own reservoir production, or at least it doesn't get released as easily. And metformin also seems to increase insulin sensitivity. So in a way, it still helps your body do the job better by increasing the receptor sensitivity. Side effects are nausea, diarrhea. For many people, they can't actually tolerate metformin at all, or at least it causes them a lot of problems. And also, any drug that you consume needs to get metabolized, and for that reason requires enzymes so that it can get excreted. And these enzymes require cofactors. In the case of metformin, to get rid of excess metformin in your system, you're actually requiring magnesium. So technically, metformin steals your own magnesium reservoirs. And we will learn in a bit why magnesium is so important for anybody dealing with diabetes. So if a medication then on the backside depletes that mineral, it actually creates a vicious cycle. Sulfonylureas, most commonly known one is glyburide, but there's also glipizide or glimepiride. They actually kind of whip the pancreatic island cells into shape and tell them to make more insulin. The side effect here is lowering of blood pressure, which could be beneficial for some, but also glyburide produces over time significant weight gain, which is again counterproductive. Then we have insulins. There's meanwhile a huge group of different kinds of synthetic insulins on the market. There's still also so-called human insulin available, which is bioidentical to our own. The difference between all these different insulins is that they can be categorized into either short, intermediate, or long-acting insulins. And many manufacturers of these prescription items create blends of in different composition, different ratios, to make life more, make it more easy to use it. And with ease comes compliance, so that you're not forgetting stuff. The way this works is obviously you would get a certain ratio, let's say a 30-70 blend of short and long-acting insulin, and you would just have to inject a certain amount of units right before the meal, depending on meal size, and you would get the short-acting insulin to work with the quick increase of sugar in the blood right during and after the meal, and the long-acting insulin helps you to kind of manage insulin for the next few hours until you take your next meal and might have to have or use another injection before that. So it is, I mean, the industry is very on the ball. There's lots of tools available to manage blood sugar once diet, lifestyle, if it's really not happening, increases blood sugar levels to rise, and also once the oral medications no longer work as well, then there's really no choice than to use insulin and also insulin derivatives by injection. And then there's, in regards to managing diabetes better, especially if already other conditions occur, you need to potentially worry about cholesterol and also about increased or higher blood pressure. So there's other meds that need to be prescribed in here as well. So when it comes to the lifestyle options, as per Diabetes Canada, it's clear that diet and lifestyle contribute to the diabetes risk, but also very clear that changes to diet and lifestyle will improve the outcomes for those living with diabetes. Regular physical activity. Diabetes Canada recommends 150 minutes of moderate to vigorous aerobic exercise per week, which means 30 minutes 5 days a week. And I would highly recommend to also include another at least 30 minutes 3 times a week lifting weights for the before mentioned shift from fatty body composition towards a more muscular body composition. Because if you manage to even maintain your weight while losing fatty tissue and gaining muscle mass, you're actually burning many more calories, even sitting at your desk. With a body that has barely any muscle left, there's no caloric combustion happening, or a lot less. And if you manage to change that, increase your muscle mass, you can consume or you can burn a lot more calories just by being more muscular. So that is very beneficial for anybody dealing with type 2 diabetes. And that has to become your life. I mean, there's really no way around it. And for so many reasons. I mean, who wants to become less and less physically active to the point where come the age of 60, 65, we are barely able to go for a bike ride for 20 minutes. Now, I mean, that's not a healthy, happy, and active lifestyle in your second half of life anyways. I think we all have to thrive or strive for staying active so that we can enjoy the second half of our lives much more and much better. Obviously, anybody that has learned about being in a state of pre-diabetes or even already diagnosed with type 2 diabetes needs to learn about your individual daily rhythm of blood sugar. So we have to monitor frequently, or you'd have to monitor frequently to learn how a certain meal affects you, how exercise affects you. Because if you see the results in your blood sugar levels by making certain changes to your diet, by making certain changes to your lifestyle, you'll become, you're in the know, but you also become much more likely to maintain these changes. And with that, slowly move your way out of this condition. Obviously, you should quit smoking or vaping, and also manage stress more effectively. That's easier said than done, but there's a few tricks that can be applied here. First of all, when we are stressed, we tend to kind of hunker down and plow through and keep stress affecting us in many different ways. It is very important to put your heads up and actually identify and recognize your stressors. This gives you the chance to either remove those stressors. I mean, I always say if a job kills you because it's too stressful, what's it worth? Even if you make a few bucks more a year by maintaining this job, if you have no life left at the end of your job to enjoy, it wasn't worth keeping that job. So these are hard decisions to make, but I think quality of life, stress management, or stress is a huge factor of our life because it creates acidity, and with that it fuels inflammation, and with that, if exposed to stress on a chronic basis, you're kind of setting yourself up for chronic disease in the second half of your life. You also should really work on your sleep and sleep quality. I can, again, speak out of my own experience. I was diagnosed with sleep apnea. I had 39 episodes of apnea per hour. That's practically every second minute. All through the night was I suffocating. You can imagine how that impacts me. And I was dragging along. And since I went through the sleep assessment and I'm now using a CPAP machine overnight, I actually, not always, but sometimes jump out of bed before the alarm goes off because I actually received sufficient replenishing high quality sleep. It feels so much better and it's worth to follow up on, especially if you were snoring or if you're known to snore, and that's a pretty strong indicator that there might be issues with apnea as well. Body weight goes down, energy goes up. That's exactly what you need to kind of reverse the vicious cycle. Lifestyle options as per Pure Lab Vitamins. Obviously, I'm not here to tell you, take these 4 or 5 supplements, stop your medications, and yeah, eat a little bit better and exercise more. This is not the way this works. Diabetes is serious and needs to be taken serious, and you cannot replace medications directly with diet, lifestyle, and nutritional options. You have to work on this. You have to learn. It's not easy. You have to learn how to grocery shop and change your grocery store habits. Find new foods that have better glycemic index. Reduce the carbs, improve the meats, go organic. Learn. You have to monitor your blood sugar levels to learn in this process how your choices affect your blood sugar levels. You've got to monitor your blood pressure if that is an issue. And you also need to then involve your medical doctor and then request guidance on how to reduce the medications once you see the results of your work. Today we know, and that's not a new thing for a long time. It actually just over the last 3-4 years since keto diet came to be, we know that diabetes is reversible, but it's not an easy task, not an easy fix. It requires a lot of personal research. It requires a lot of motivation and discipline to pull this off, but we can reverse type 2 diabetes today with diet, lifestyle changes, as well as potentially supplemental or nutritional interventions. And key nutrients in this process of relearning your life and lifestyle can certainly help in this transition. So why do we end up nutrient depleted? There's a number of reasons here. First of all, I think we all can agree today that our soils on which we grow our crops are mineral depleted. That's actually researched and proven without a doubt. There was one study that stuck out for me where they kind of investigated the food basket at the turn of the last century at 1900, and they were able to show that Canadians at that time received around 500 milligrams of magnesium per day from food alone. Today, when you take a Loblaws, IGA, Metro food basket as we consume it today, we barely get 200 milligrams of magnesium from our food. And that is significant because the RDA, the recommended daily amount for magnesium per day, is about 420 milligrams. Furthermore, if we consume processed foods, they get washed, cleaned, and processed, and with that, lose nutrients, especially minerals. Also, processed foods contain preservatives, also coloring and other additives, and these all need to be metabolized in our biochemistry in order to be excreted. So they all steal nutrients from our resources. Eating clean helps you keep these nutrients for your own use. Prescription drugs, as I mentioned before, also need to be metabolized and require enzyme cofactors for that. So if I pick out the average prescription cocktail for diabetes and metabolic syndrome, like for example, like all the metformin, glyburide, but also beta blockers, ACE and ARB inhibitors, diuretics, and the like, cholesterol-lowering drugs, that over time depletes our body of magnesium, coenzyme Q10, all the B vitamins, but also iron, zinc, and vitamin D. So those are all nutrients that actually aid in the bigger picture of cardiovascular disease and the other complications of type 2 diabetes. And the medication we take to treat this condition steals these nutrients from our reservoirs and makes practically the condition go worse. Tough but true. So magnesium in diabetes and metabolic syndrome, very straight connections here. Magnesium enhances secretion from the pancreatic islet cells. It activates insulin. Insulin as a hormone is not active unless one magnesium is bound to it. It's like a lock and key kind of function here. Furthermore, magnesium directly enhances insulin sensitivity at the cellular receptor site. So there's 3 reasons why every diabetic needs to be on magnesium daily. It's very clearly known that low magnesium levels directly worsens the symptoms of type 2 diabetes, and also low magnesium supports insulin resistance. So every diabetic needs to be on a good magnesium supplement daily. In Canada, supplement doses are being defined by Health Canada, and they base their decisions on how much to use on the so-called RDA levels, or recommended daily amounts, which are levels for each nutrient based on the findings in the food basket from the late 1950s. RDA levels have never been researched. They are still, or today, 70 years old. And if we follow this string of thought that our soils are over time more and more mineral deficient, then we can say that it is wishful thinking that our food basket provides RDA levels. I mean, we know that already, that with our regular food supply, we barely get 200 milligrams per day, which means in order to just meet your daily requirements, you need to supplement. There's no way around it. With 3 capsules of my magnesium glycinate at 165 milligram per capsule, you're getting around 495 milligrams in a day. But if you start out deficient or even depleted, and you only put the RDA back into your body on a daily basis, it's like, I always compare that to a car. If you know you're going to be driving 100 kilometers tomorrow, and you put 10 liters of gas into your tank, you will make it to your destination. But at the end of the day, your tank is again empty. And that's the same in a deficient individual. If you're putting only the RDA, the recommended daily amounts, into your tank, you will make it better through that day, no doubt. But at the end of the day, you're still fully deficient. So in order to change that, I always emphasize, for somebody who has never used magnesium before, you should use higher doses in the beginning. That means, and I recommend to just, for somebody who never tried magnesium before or never has, and has been diagnosed with diabetes anyway, or shows any kind of number of magnesium deficiency symptoms like headaches, constipation, spasms, cramping, PMS, I think I've said migraines. There's actually a large number that can be viewed online as well. If you have any number of these conditions, which indicates that you are dealing with a more severe deficiency, then 3 capsules a day won't cut it. So I would recommend to use 6 a day in divided doses. For example, 2 in the morning, 2 in the evening or late afternoon, and 2 at bedtime. More towards the evening, because magnesium glycinate is so nicely relaxing, it helps you sleep better and deeper. And you're absorbing well overnight anyways. So, and you do that for 2 weeks, maybe 3, and then go down to maintenance dose of 3 caps a day and coast on a full tank. B vitamins. If you believe me or have heard it before or are of the opinion that our soils are mineral depleted, that also has a consequence for the crops that we consume, because they require minerals just as well as cofactors to activate their enzymes to make B vitamins as part of the plant's metabolism. So that means if our crops grow on mineral depleted soils, then also the B vitamin content in these crops goes down. But yet, stress, and we are all exposed to it, not just since the pandemic, stress depletes us of B vitamins. Our daily requirements of Bs go up. And our diet, following this string of thought, contains less and less and less B vitamins. So that directly leads into a discrepancy, leads into a deficiency of Bs. And Bs are hugely important. They help protect nerve endings in the diabetic. And energize the system. They help metabolize carbohydrates, fats, and proteins. They generate energy for the body and the brain. And also, on top of that, get depleted by the medications you're using to treat type 2 diabetes. So there's really, from my point of view, in today's world, in the year 2020, B vitamins are a foundation product. There's no toxicity known, at least not in anywhere close to the doses we put into a good therapeutic B complex. It's a no-brainer from my point of view to give B vitamins to anybody in the world. B vitamins are water soluble. They flush through us very quickly, and we can actually see that because within 10 minutes after taking a regular B complex, you start peeing very, very yellow, which means the B complex has absorbed from the gastrointestinal tract into the blood, has been flushing through your body, Cells and tissues can take it in, but as soon as higher levels of B's kind of flushed by the kidney gets all jittery and says, "Oh, that's like a super high B1, B2, B3, B9, B5, B9. So we might as well kind of drop and lower blood levels so it ends up in the urine very quickly." A regular B complex flushes through you in about 60 to 90 minutes. And your urine turns clear again. Enter my bioactive B complex, slow release. First of all, I'm using not just regular B vitamins, I'm using the bioactive forms. To give you an example, vitamin B6, pyridoxine, has to be phosphorylated in our body to become P5P or pyridoxal 5-phosphate. So I'm thinking, okay, why not use P5P right from the get-go? You would never go into a store and call and ask for an empty Duracell battery and then carry it home, plug it in the wall, wait 6 hours, and then use your, I always say Walkman, but nobody uses them anymore, use your device you want to use. No, you want a charged battery, and bioactive B vitamins are practically charged batteries, charged B vitamins. So they can be utilized in the body right from the get-go. But the most important advantage of this part is its slow release formulation. And the proof is in the pee, not the pudding. If you take 2 capsules of this product in the morning, you will still pee yellow when you come home after work. It maintains blood levels, for 10 to 12 hours, which means the cells and all tissues of the body actually have access to these B vitamins for 10 to 12 hours. And with that, you are improving energy production, detox, metabolization on all levels of the body with the presence of bioactive B vitamins. I'm most proud of this product. It's therapeutically dosed. It's practically a B50 complex bioactive per capsule. By using this in slow release form, you're maintaining B levels throughout the day. And you can feel that. You're energized. Also, one little tip here is many of us deal with like significant drop in energy mid-afternoon into the evening. You have your exercise session scheduled for 5:30, 6 o'clock, but your energy level is gone. So you could use this product right after lunch. This way, hopefully with good sleep, you have enough energy in the morning anyways. Take the B complex at lunch. It'll energize and power you through the afternoon into the evening. You're actually saying, yeah, I'm going to my exercise class at 6 o'clock and still come home well, happy and energized. And you're actually benefiting from this increased energy at the right time. Works beautifully. Furthermore, vitamin D. There's clear evidence that vitamin D deficiency is directly connected to a higher incidence of cardiovascular disease and type 2 diabetes. Also, higher risk of heart disease, stroke, hypertension, and diabetes in another second study. And as Canadians, vitamin D is kind of at the top of our mind, but I believe not sufficiently. Vitamin D also improves the body's insulin receptor activity, the sensitivity towards insulin, and can, for that reason, if you have maintained proper vitamin D levels throughout the year, reduce the risk of insulin resistance. Here, it's a bit of an excursion into the viral impact, immune system impact of vitamin D, just because it's so important. This is a study performed by the Grassroots Health Initiative. It's a non-for-profit organization. I just find this slide mind-blowing. Just to explain this here quickly, because vitamin D has huge impact on our ability to stimulate our immune system. Here, you see this group has taken a total of almost 200 people diagnosed with COVID-19. So they already had the virus, and then separated them into 4 groups, those with only mild, ordinary symptoms, severe symptoms, or critical symptoms. The definition of mild was interesting because that was people that had the virus, but had no diagnosis of pneumonia whatsoever. So they tested positive, but it only had like flu-like symptoms without the development of pneumonia. So then they took these 4 groups and tested their plasma vitamin D levels. And you see average distributions here within the groups. 50% had very low levels of vitamin D. But what sticks out like a nail, in the mild COVID group with only mild symptoms, 98% had vitamin D levels over 75. And that is significant. That is unbelievable. That means if you manage to maintain your vitamin D levels through winter and summer over 75, which is still not in the middle of the range. The reference range for vitamin D in Canada is 75 to 150. So 75 is just the bottom of the range. We should actually aim for vitamin D levels of 100, 120 to be within, bang in the middle of the reference range. So, but this can only be done with blood testing. So Health Canada today, in July of 2020, still recommends 1,000 units of vitamin D. And I believe that's not enough. Your body, if you would hunt and gather dressed in a loincloth, living close to the equator, expose your body to 12 hours of sunlight, your body's surface area, all of it, your body would produce 10 to 25,000 units of vitamin D. So that doesn't it doesn't jive, right? But I cannot, since vitamin D levels are a very individual thing, depends on your lifestyle, on your exposure to sunlight, on many other factors. And vitamin D is a fat-soluble vitamin. That means it can accumulate in your body and at some point even turn toxic or give you side effects. I cannot sit here and tell you, you all should take 10,000 units every day, because that's not right. But there is a way to determine your body's requirement by testing your blood levels. And there's a very quick and easy video on YouTube, on our YouTube channel. You enter Pure Lab Vitamins into the YouTube search bar and get a whole slew of small little videos of myself all the time. And one is called Vitamin D Optimization. And this you could show to your physician or a naturopath and then follow the steps in this process. Quickly, in a few words, even in the summer, especially when it's that hot outside, we do not expose ourselves to sufficient sunlight, period, unless you are working as a roofer or gardener. But even then, you would dress up, cover your skin because of UV radiation. So we don't get enough sun even in the summer. But you have to, and actually right now would be a perfect time to test your midsummer vitamin D levels in your blood to determine whether you need to supplement with vitamin D even throughout the summer to maintain at least blood level of 75 so that you are protected as good as possible to allow your immune system to be as strong as possible to fight an immune infection or a viral infection down and only experience milder courses of the disease that might be coming in a second wave. Don't want to scare you here, I want to educate you. I think vitamin D is paramount in helping us maintaining general health if we actually manage to maintain blood levels where they should be. I believe that vitamin D testing should become mainstream and should be monitored much more closely so that we all learn what we as an individual require throughout the summer and then most likely much higher throughout the winter, where we as Canadians expose this much body surface area for minutes during the day. I'm coming to the end. Don't fall off the table or wherever you are. So zinc is another very important supplement in type 2 diabetes and also the immune system, similar to magnesium, especially if we have fluctuating blood sugar levels with excess phases of excess thirst and excess urination. We actually lose minerals, including zinc. It's very clear that individuals with type 2 diabetes or type 1 have, on average, much lower zinc levels in the system. And zinc is also involved in the production and secretion of insulin within the pancreatic islet cells. There was a study here also available on PubMed, and it was clearly shown that zinc supplementation decreased cholesterol levels, but also the so-called HbA1c level in blood, which is a 3-month marker of fluctuating blood sugar levels. So it was clearly connected to successful results if supplemented daily at proper levels. Zinc dosing, I actually made our product also an amino acid salt, zinc glycinate, at only 23 milligrams per capsule. With good reason, because I did a lot of hair mineral testing over the last 15 years and saw many people with low zinc levels that then used 50 or 75 or 100 milligrams of zinc daily ongoing. And at retest, which is usually 3-4 months later, we test hair again, and they had like overshooting zinc levels way too high, and at the same time practically zinc copper disbalance. That's another talk for another time. Anyways, at this dose of only 23 milligrams per capsule, you would start using zinc for the first 2 weeks, 2 caps per day, and then dose down to maintenance of only 1 capsule per day ongoing. And this way you not have this overshooting zinc load and not have a potential zinc copper disbalance 4 or 5 weeks later. Works very well absorbed, should be taken with food. Some people experience gastrointestinal discomfort on zinc supplements, even though bound to the amino acid glycine. Those side effects are not as strong anyway. So heads up. Dealing with diabetes is a lifelong learning process, and nobody, and we have today in the stores a lot more good tasting, low carb food choices, a lot more awareness in the staff of these stores. And the industry is paying a lot more attention to this, so there is much more choice. But we have to actually relearn how to grocery shop. You got to experiment. I've got to find good tasting alternatives and learn how to prepare them properly so that they actually do taste good and still maintain lower glycemic index. And with learning about these new things, you also learn to appreciate those things, and you become much more likely to stay compliant, because that's the biggest problem. Everybody that wants to kind of go and make a change is motivated in the beginning, but the problem is to maintain this motivation and the discipline long term, and really change this into your new lifestyle. That's what this is all about. You have to be patient with yourself, and nobody expects you to be perfect at the end of this presentation. It takes time, and you got to give yourself time, but you got to keep your goal ahead of you and work towards it. Maybe even start a group and kind of share experiences. If 10 people go out shopping and test funky foods, it's much more likely to find good products and learn from each other's experiences. That always helps. And don't think that there's a lot of people in the same boat. So building a group, exchanging information, that can help a lot and also keeps you motivated. So I believe that's the end of my presentation. I hope it was of help or of interest to you. You should get a link in the email with the recording. It takes about a day to process that. And I will stop sharing now and stay with you. Here we go. And we're going to go through a few questions that are here. Julie Goldring. Hi, Cyrus. There's a question from Julie. Yeah, I kind of answered this question, how much vitamin D I would suggest. I mean, in general, rule of thumb, I think it's safe to take 2,000 to 3,000 units during the summer. And I would think that you should like take 4 or 5 during the winter. And that's just a base recommendation without any knowledge about you and your lifestyle and your average exposure to sunlight. I would highly recommend to go and get blood work requisition forms from your MD or ND, not just 1, but 2 or 3. Then establish the dose of vitamin D right now that you feel comfortable with. Take it for 2-3 weeks and then measure your blood, because this way you are kind of measuring what level you achieve with that dose. And if you see that your level is still way below 75, now you have evidence that you, even in the summer, need much more vitamin D to maintain blood levels over 75. And then you take it from there, and you technically have to redo the same thing come fall, because then your body is covered and there's no more UV exposure whatsoever. We're going into 5 months of winter. So your daily requirements to maintain blood level over 75 during the winter will be much higher, but I cannot tell you how much it is because you are an individual, you have individual biochemistry, diet, and other factors. So you'd have to test and potentially retest again during the winter. But once you've done that once, you have benchmarks, and then you can say, okay, my safe dose throughout the summer is this much, my safe dose throughout the winter is this much. This way you optimize your metabolism and your ability to kind of reduce inflammation, lift your mood in the winter, and also your immune system overall. I hope this answers your question. Done. Here I have a question from Gary, and I think I answered this question as well. He writes, how much magnesium do I need to take daily? Taking 4 caps currently after 2 years. I assume you mean you've been using it for 2 years. So you're no longer a beginner. You know that 4 capsules kind of tends to do the job. You can always use your bowel response as a bit of a gauge as to whether you get too much or too little, because if you're experiencing loose stools on 4 caps a day and they become too loose, then you dose down. Technically, the bowel is a very responsive indicator whether you get enough or too much. If on 4 caps a day you're still dealing with constipation, you would should go back onto a 1 or 2 week replenishment phase with higher doses and then come back down. That's beautiful with magnesium because of this safety valve. It works like a charm. Oh, I have Melanie Raymond here. Hi, Melanie. I know her personally. She's actually my wife's cousin. Any issues with diabetic drug interactions and supplements? No, other than the fact that the drugs actually deplete coenzyme Q10. If you're using any atorvastatin for cholesterol, it blocks the enzyme that in our body that makes CoQ10. So if you're using atorvastatin or any other statin drug, you need to supplement with CoQ10, and ideally the bioactive form, which is the ubiquinol. I make one product called MTQ. MTQ stands for magnesium taurine CoQ10. It's a cardiovascular magnesium formulation, and that includes at full dose 80 milligrams of ubiquinol. It's a very good product. Sorry, I'm clicking through the questions here. And again, yeah, there is no contraindications of the supplements I discussed with any of the diabetic prescription drugs. Okay, I have another, that's Julie saying thank you. Oh, that's a good question from Jenny Brousseau. Does this info on supplements apply to type 1 diabetics as well? Absolutely, yes. Technically, even the synthetic insulins that we inject still require magnesium to become fully active. Also, when it comes to the receptor sensitivity in type 1 diabetics, magnesium is hugely involved, as well as zinc and vitamin D. To protect the nerve endings and provide energy in all tissues of the body, you need the B vitamins. So yes, all these recommendations apply for type 1 diabetics as well. I hope that answers that. Oh yeah, that's an interesting question from Terry. He asks, for someone who's likely magnesium deficient but has loose stools without any supplemental magnesium, would you still recommend magnesium supplementation? Yes, yes, yes. Somebody most likely due to dietary sensitivities, food sensitivities, chronic inflammatory bowel conditions like IBS, Crohn's, and the like. If you're dealing with looseness on a regular basis, you're losing water and with that minerals on a regular basis as well. Your system is highly mineral deficient, and you kind of indicate that in your question anyway by saying that you're probably likely magnesium deficient because you're probably dealing with spasms, cramping, headaches, twitchy eyelids, twitchy neck muscles, twitchy shoulder muscles, or any muscles. Those are all deficiency symptoms of magnesium deficiency. But how do you get it into your body? It's easy said for me. So yeah, just take it, but then you would be very, very loose. So one trick that can be applied here is to use our magnesium powder or open the capsules and dissolve a starting dose of maybe just one capsule in a big bottle of water. You can also put lemon juice in there or any other flavoring agent. And instead of taking the capsule or the scoop of powder in one shot, you're simply sipping that water over the course of the day. And with that, with each sip you take, you're just using a very small increment of the magnesium dose over the course of the day. And that should not overload your gut muscle and cause further stool loosening effects. And you're slowly absorbing small portions of that magnesium into your system, which will also make your gut muscle less responsive to magnesium. And after just a few days, you can most likely already start using 2 scoops or 2 capsules per day in your water. And you're slowly replenishing your system and will benefit over time. Obviously, I would suggest for you to investigate why your system is so responsive and maybe do some food sensitivity testing. Consult with a naturopath that is specialized in gastrointestinal health to see whether this can get fixed for a number of reasons. I hope this answers yours. Larry Ann Connery asked whether fasting blood sugar is less important than the A1C levels that can be tested today. Yes and no. If your fasting blood sugar is way above 5, you have an acute problem. You're not managing sugar levels properly. That has to be addressed. If you're diagnosed with prediabetes, I believe that your A1C levels are much more important to look at because it gives you a 3 months average of your situation. And it's actually a very valuable test. But I think depending on where you are between pre-diabetes and yeah, please, I'm getting more water brought. Thank you, thank you. You need to determine where you are between healthy pre-diabetes and type 2 diabetes, and then, I mean, your doctor will kind of request the specific tests anyway to get a bigger, better picture. I hope this answers yours. There's a question here from B. She asked, where are Pure Lab supplements sold? Well, we are sold in pretty much any health food store in the greater Ottawa area. Take your pick. We're also present in southern Quebec, Montreal, in the GTA. We kind of focus as a regional company. We are proudly from Ottawa. and support our people here. But you can also get it online. There's well.ca. There's some vendors on Amazon, and we also have a shopping basket on our website for those living in rural areas. So it's pretty much everywhere. Many pharmacies in the city carry our complete line. You can also go to our website. There's a where to buy button, and you just enter your postal code, and the system generates the stores closest to you. You can also call the office and get that. We can find it out for you. There's a question here, quite significant. What about a type 1 diabetic that had a kidney transplant? I mean, even a transplanted kidney requires nutrient support. There's truly no reason why somebody with a kidney transplant should not use or require or get adequate nutrient amounts. And that includes magnesium, zinc, D, and also includes B vitamins. There's no reason not to do that. The only reason not to use supplements, and in this case would be the AlkaPure, if the transplanted kidney is no longer able to manage sodium potassium levels properly, which shouldn't be the case, hopefully. In that case, AlkaPure contains sodium and potassium in balanced amounts. Also contains bicarbonate, which is oftentimes prescribed for anybody on dialysis to maintain pH levels in the system properly. But this needs to be discussed with the urologist that is involved in that patient's care. Magnesium should not be a problem at all for the person with kidney problems today, and also not for the person that already has a kidney transplant. We're coming to the bottom of this. I answered this one. Oh, there's Melanie again. Specific recommendations for leg cramps. Magnesium is the first one to use, and also potassium. Those are the two key nutrients helping the muscles stay relaxed. Magnesium is the body's relaxer. Calcium is the body's contractor. I would assume that you at your age, because I know you, are not on any calcium supplement now. And if you are, I would question the dose there. Calcium, if taken too much, can make you crampy. You can then either balance with more magnesium or lower the calcium and bring in more magnesium. One other interesting observation, if you had been using magnesium already and still kind of experience cramping, there might be a problem with the actual utilization of magnesium into the muscles. And the product that I mentioned before, called MTQ, might be of help here. The taurine, which is an amino acid in this formula, is known, actually, let's start this way. Taurine, when you actually dissect the body and look for taurine levels in all kinds of tissues in the body, you find highest concentrations of this amino acid in the heart muscle. So for the longest time, taurine was used as an anti-stress amino acid, as anti-inflammatory for the gut, as an energy tool in drinks like, what's it called again? Red Bull.
Red Bull.
Yeah. And, but they asked, like, why is it so highly concentrated in the heart muscle? And then they did some research there and were able to find that taurine helps funnel magnesium and potassium deeper into the muscle cells. So that's why it became this connotation of being a cardio supplement. But it does that in any muscle. So if you're experiencing leg cramps, despite the use of regular magnesium, even this good stuff here, then you might be in need, or you might benefit more from the MTQ twice daily. And this way increase the intracellular levels of magnesium in your skeletal muscles. Yeah. Whoa, what's the timing now? 3:15, 3:16. So I'm only 15 minutes over. There's no questions left. I hope this was fun. It was fun to me, even though I much prefer real lectures with people and faces in front of me instead of a screen. Yeah, I thank you again for participating, and have a great day, and hopefully take this information to good use, and start learning, become better diabetics. And with the right kind of attitude, you learn, you improve, you have more quality of life, more happiness, and yeah, better outlook. Thank you. Bye-bye.